Guys, this is Dr. Russel Williams from the Y Factor, and I would like to talk with you about what constitutes an adequate male infertility evaluation. And the American Society of Reproductive Medicine, which is the parent company that establishes best practices based on physician experience and the peer review literature, suggests that an infertile couple should undergo a simultaneous male and female infertility evaluation. The male infertility evaluation should consist of a comprehensive history and a semen analysis. And they further go on to recommend that if there's any abnormality within the history or there's any abnormal parameters within the semen analysis, that they then should go see a reproductive urologist who then can complete a detailed physical examination and maybe some additional studies. So let me pivot and let me talk a little bit about the semen analysis. So a semen analysis is what many of us know is an ejaculated sample into a cup that then is analyzed under a microscope. And there are several important parameters from a semen analysis, such as count, motility, which is the ability of the sperm to swim, and morphology. Morphology is the shape of the sperm, which really has ramifications for what happens when the sperm encounters the egg and the ability of the sperm to engage in the egg and fertilize the egg. There's some other parameters that come off the semen analysis, like volume and the presence of inflammatory cells or red blood cells, or whether there might be some autoimmune related problems within the semen analysis, but we won't go into that right now. Another aspect of the semen analysis, not so much the quantitative aspect like counts, motility, and morphology, but that is the qualitative aspect of the semen analysis. And the qualitative aspect is the ability of the sperm to initiate the fertilization process and be able to allow that egg to then progress on to a viable pregnancy. And one of the key components of the qualitative aspect of the semen analysis that is not appreciated in your standard semen analysis is the sperm DNA quality. And we are here at the Y Factor involved with assessing guys' quantitative semen analysis, but also the qualitative aspect of their sperm. One thing that I think is important for guys to realize is that if you have an abnormal semen analysis, it does not mean that you have to undergo in vitro fertilization. Yes, in vitro fertilization can be an effective treatment for the abnormal semen analysis, but also male reproductive treatment, male reproductive evaluation, and male reproductive treatment can also restore or improve your fertility and enhance your options of conceiving without having to undergo in vitro fertilization. Here at the Y Factor, the semen analysis is ordered and interpreted from the perspective of what is going on with the man's body, what is his physical examination, what are treatable factors, and what's the likelihood that we're going to improve on his semen analysis. We are now offering in our office the ability to have a semen analysis, which is actually collected at your home, analyzed, and then the results come back to us, and we're able to sit down and talk with you about treatment and how you're going to improve, and the likelihood that through treatment and improvement that you might be able to initiate a pregnancy through natural ways, through timed intercourse, or through insemination, or whether that you might have to proceed on with more advanced fertility treatments like in vitro fertilization. So let's recap. If you have suspicion that you might have decreased fertility, or you and your partner have been trying to conceive for 8 to 10 months and have been unsuccessful, it's important that you have a semen analysis and somebody to review your history. At the Y Factor, we will order your semen analysis and we will interpret your semen analysis from the perspective of a male reproductive urologist who is the specialist in male infertility.